We're visiting Virginia Family Dentistry, introducing you to Dr. Paige Holbert. She's an endodontist with the team here. And this is really interesting. It's painting the picture of really oral care in a different way. You often work with patients with root canals, right? And before you recoil, because a lot of folks get nervous about a root canal, it's actually thinking about it in terms of pain relief, right?
Absolutely. Yeah.
See a lot of patients creating beautiful smiles, but typically, when are patients seeing an endodontist?
So an endodontist is specifically a specialist in dentistry that deals with the internal structures of a tooth. That includes the nerves and blood supply that runs up inside a tooth. And so when you see an endodontist, you've typically had either sensitivity or swelling or pain or trauma associated with your teeth or tooth that needs to be dealt with by a specialist.
And Paige, you're really in the business of saving teeth. That's your main goal.
Yes, yes, that's what we do. Endodontists specialize in saving teeth.
Typically, when a patient is coming in to see you, what kind of symptoms have they experienced?
Again, they have felt some sort of sensitivity, maybe to hot and cold, maybe to pressure. Oftentimes we see patients that have cracked a tooth and therefore feel pain when they chew or bite into something. And like I mentioned, sometimes that includes trauma. I certainly see a lot of children in my practice who engage in lots of fun activities that can also include dental trauma that happens during those activities.
And when you are in the business of saving teeth and creating or preserving a beautiful smile, that takes a lot of work. People do get a little nervous about the idea of having a root canal, but what should you expect when you come in? There's a lot today to make folks much more comfortable with having this done.
Root canal treatment has really come a long way. The most important thing I tell all of my patients is that there's no pain associated with having a root canal. I think many people think of root canals in association with pain because they've had so much pain prior to the dental visit. We have very advanced anesthetics and technologies that help us diagnose the tooth appropriately and make sure the patient is completely numb for the procedure. After the procedure, you can be sore for 2 or 3 days, and that's relatively normal, but that should subside with time, and the tooth should function in your mouth for a very long time after a root canal.
And you raise a great point, right? You're so used to having maybe lived with or tolerated or dealt with that pain, you're thinking of that as part of the procedure, but it's not. By the time you're having this done, that's all about relief.
Right. Endodontics is all about relief of the tooth pain that you've been having, yes.
So you're a specialist within the practice here at Virginia Family Dentistry, and focusing on that internal structure and everything requires a little additional schooling.
That's right. Endodontists are specialists in the dental field. All endodontists are dentists, but less than 3% of dentists are endodontists. And we go to 2 or maybe 3 years of more schooling to learn how to specialize in the treatment of diagnosis and treatment of teeth that need root canal therapy. That is what we do.
Dr. Holbert, it really is exciting because the technology that's available today is light years beyond where it used to be, and it really gives you a different perspective with the work that you're doing.
Oh, absolutely. So now with endodontics, we use microscopes during all of our treatments that really show us a lot more on the inside of a tooth. They're well lit. We can really see what we're treating on the inside of these teeth. And on top of that, we can use cone beam CT scanners in our office that give us a 3D image of exactly what we're getting into before we access the tooth to do the root canal procedure.
So to the average patient, you might not necessarily know that technology, but to give the doctor that opportunity to have those tools of the trade is really just pretty phenomenal.
It's great, and we get and it's very cool with the patients because we can show them the pictures of their teeth and their bone structures and what dental infections do to your bone and how we can heal those things.
You really do get an inside perspective, and
Yes.
that probably helps reduce that anxiety a little bit.
Absolutely. Yep.
Well, it is about saving teeth. It's about creating a beautiful smile and pain relief. That is key. Thanks for giving us the overview.
Thanks so much.